We're here today as part of the Hychara Health Exchange, and we're excited to share our thoughts around some changes that we see in the industry. My colleague Amy is not only clinical practice, but she is in the clinic with our providers all of the time, mentoring. And Kelsey has now with Hychara, has also been with TAA for a long time and manages all of our front office operations. And the three of us collaborate, push and pull on each other on a regular basis. So we thought this would be a good topic to begin to look at. As COO, I feel like TAI, like every outpatient PT practice, has our list of metrics. We're outpatient PT, so there are new patients, their visits, and their units and RVUs. But how we use those numbers and have a thriving, successful business, we each have different vantage points on that. Since the beginning of the year, we have been looking at really our business units or our clinics. We have 91 different unique clinics, and like every other large business, we've shrunk. We've had to reduce our footprint because of staffing shortages and looking at where our patient needs are. And when we started the year with 91 business units, we ran 85 different ways. So now as we fast forward to today, we're down to about 30 unique ways, and that's still too much. But as an operations person and a PT, I look at it from the data and the numbers and what could we be? And then I look to my colleagues here to say, okay, what else should we be looking at? And Amy, I don't know if you want to share some of your thoughts or journeys as we've evaluated, how do we look at our clinics? Because from my role and from our CFO and for all of you, we're looking to how do we scale? How do we grow? Could we acquire? Do we need to shrink? So we're trying to make business decisions. And then we have you to help keep us kind of in check on what do our providers need in order to make some of these business decisions.
Yeah, I'll start by just even explaining what clinical practice is. So as the director of clinical practice, I work really closely with our education teams, with mentoring. That's actually how I started, was as a mentor. And I think what I saw in clinics is as we're mentoring, there's a lot of opportunity to enhance and guide and support providers' professional clinical development. But in reality, great clinical skills don't thrive unless you're in a system with workflows and structure that helps clinical practice actually occur and happen. And so there's a lot of opportunity to help coach providers around all the things that make up patient care and thriving in a clinic. Some of that is digging into understanding the systems in our clinics, making sure our clinics have better systems, that our technology is serving providers. We need to be listening to our providers and also understanding what our patients' needs are. So not only is clinical practice focusing on education and professional development of our providers and our teammates, but also in looking at how can we enhance the quality in all of the clinical practice that we're delivering, making sure our providers are having an optimal experience, but at the end of the day, so that our patients are having the best experience. So I get to work with a lot of other departments, like the operations teams, our technology teams, our front office teams, to try to make sure that we have systems in place so that we can deliver and execute that great care.
Yeah, and to play off of what Janine was talking about with our model and having different clinics in arrangement of how we operate operationally, it is, from a front office perspective, also a challenge when you have clinics that are running different models across the spectrum. So we're really trying to focus on cross collaboration through our SOPs. Our clinical education team and clinical practice and our front office operations collaborate on a weekly basis to try to figure out how we can support our clinics, not only for an operational purpose, but so that our PTs who are going into various clinics, our front office, they all have this understanding of their role and what they should be doing to make the clinic successful and move forward.
I'll just speak a little bit to some of the history. I think, as a company, we've had historically a lot of really great clinics that have really great ideas and good intention. And even just at that, we've had a lot of clinics with good ideas and good intention, which leads to a lot of different workflows. And to be efficient as a company, we can't have 80 different workflows, even if they're great ideas. So our goal with creating some more centralization and standardization has been to listen to our teammates, hear about their processes so that we can learn and apply, like, this is going really well here. This is a great practice. How can we apply this for everyone so that we can really help everyone get a leg up and be more efficient, in essence, as a company. But I think it is a challenge at times because change is hard. And especially when you have a system that's working, it's hard to pivot. And so to educate our team, to get everyone on board, it takes some time and training and understanding the why of what we're trying to do and make sure people feel heard. And also, promote that we're consistently working on evolving documents and evolving systems so that we can continue to enhance these systems, but do it together efficiently, so that we can all benefit.
One thing that's striking me, being in 4 states throughout my career and multiple different companies, is that our ability to listen to our clinics and take what they're trying to share with us and then trying to make a best practice and an SOP. I think we're like every practice. I think any PT in the company and any PT in leadership in the company would say that our patients are first, our communities are first. That's how we were built. And yet, to be successful, what I appreciate the most over the last 11 years here is that I can have a direct focus on operations and financial stability and thriving because I know every single day, Amy and I, clinical practice, or all of our different departments, everyone has an equal voice. And that is also, I think, really important, whether you're a small practice or a large practice. You really have to collaborate and hear each other's voices for whatever your end goal is. And hopefully that is all of our patients for our communities.
Yeah, I think, especially and related to that, what's really important is that, clinical practice, quality, and operations, we have the same goal in the end, which is providing this optimal patient experience, getting people access to care, supporting our providers in their development to provide that care. And it helps quality clinical practice to have something for providers to measure themselves against. But also we have to let me back up again. When we're working towards any kind of metric that helps our businesses thrive and stay in practice and stay in existence, I think it's really important for providers to understand how that's serving their patients and how that's promoting good patient care and clinical practice. And so that's why it's so important for operations and quality and clinical practice to work together closely. We generally have the same goal, and I think we're really in alignment. But the way that gets communicated to providers at times, if it's not done in collaboration, I think it often fails when we look at other companies and other systems. So providers need to understand the why. We have to help them understand the system to get to this point so that we can make sure we can keep our doors open. We have to make sure that we're communicating with our patients, that we're making good prognosis around how long is it going to take for this person to get better, support providers in that development, make sure they're communicating appropriately with their patients. And then at the end of the day, making sure there's a system in place to get that patient scheduled and have follow-up to reflect on the care, to make sure patients are understanding the value of what's happening. So there's so much education and training around the quality of delivery of what we're doing that has an operational impact, and helping providers see the connection helps us thrive and helps us keep our schedules full. They really should serve each other.
Kelsey, I'd love to hear from this whole scheduling piece. And, we work so hard to get these new patients in our door and schedule appropriately with all of the administrative burdens and our downward pressures of different payers and requiring different levels of clinical care in order to get paid. How does that impact you and your team?
Yeah, from a front office perspective, the goal is still the same as clinical practice. So getting patients in the door, keeping our schedules full, it all revolves around this patient experience. But I think where we tend to drift apart front office to back is really in that communication. So, making sure that when patients come into our clinics and walk through our doors, they are understanding what physical therapy is from the start, and then having that really follow them through this journey to get that buy-in to come back to our clinic. And so I feel like where we see a lot of the drop off in some of those operational efficiencies is just patients who aren't getting back on the schedule, and maybe it's because they don't understand their plan of care, or maybe it's because our front office isn't explaining the importance of getting on the schedule and really making it a priority. And there's also pieces that have to fall into play. If you're a small practice, you might be okay with, not using technology to your best ability, but you step into these larger practices and you have to lean on your wait lists and inactive lists and all of these things to make sure that your patients are getting in. So it really kind of depends, but I think a lot of the barriers that we see is just that communication front to back and really bringing that forward in everything that we're doing when it applies to scheduling.
And you've mentioned it, and now you've mentioned it, Kelsey, this technology. At Therapeutic Associates, we think we've been using technology for many years at the forefront. And I would say over the last 18 months, it has just even exploded more because Therapeutic Associates is a client of Hychara Health, meaning we're buying all of our technology services from Hychara, from our EHR to our ambient scribing with Prediction Health to, I'd love for you to speak to the pilot you're helping to run with Hychara on our online scheduling using Second Door Health. And where I live, and the piece of technology that we've used for more years than what I've just described is really our data gathering, our BI, our business intelligence, and how we bring data together, not only for the executive team, but the clinic leaders to run their business, but now all the way down to the staff physical therapist and physical therapist assistants to see the data points that we feel are key. But I'll go to you first just on the scheduling and the technology and what we're trying to do. And then I'd like to hear from Amy on our Power BI, because we had the data for our staff physical therapists for the last 10 years. We didn't give it to them for 2 years ago because we had a little bit of trepidation. And I'd love to hear from you once we did that and then where we went. But
Yeah, as far as an industry, one of the gaps that we're seeing just across the board with scheduling and front office management of schedules is just everything is usually in one person's central brain. You've got someone who's really great at this Tetris ability to manage a schedule, and we're really missing out on using some like smart logic for scheduling, knowing where to put patients, where are our hot spots and times, what therapist seems to get all the evals, and then what therapist, has this specialty that we can't fill. And so what I would love to see from a technology aspect for future is really applying this logic into some sort of online scheduling management system. What we're trialing right now is a pilot for bringing in not only online scheduling, because a lot of the systems have had online scheduling for a while. Athena has an online scheduling tool. But where we find the gap is it just doesn't have that same logic where you can apply insurance rules and insurance time, what payers we can use our care extenders and our care teams with. And so really building a inclusive online scheduling platform that allows for us to do that. And then also having a system that helps our front office, if someone drops off the wait list, have an automation that goes to the wait list management to pull that patient in because the system recognizes that's a patient that normally likes that slot. So really trying to build in the logic of what our front office is doing. And right now the pilot is going really well. It's been running for a couple of weeks. We've seen a big influx, and it's using some of that panel management as kind of a first pass. So really trying to figure out a way to have a stable payer mix within a clinic as well is also a scheduling challenge. And Second Door is really helping us to try and manage that.
I was going to add, I think one of the things that I heard you talking about is the importance of recognizing that you have to write rules, right? So I think a lot of providers have, I shouldn't say providers, there's a lot of people that have apprehension about this process, especially knowing that there might be certain reasons and rules that they would might maybe get someone in a certain way or schedule people in a different way. And PTs are used to there being a lot of different components to it. And the PTs and the front office teams have always kind of managed it. If you know your team, you know how to do it. And some teams really thrive. And at the end of the day, what we're trying to do is recognize there aren't just rules. There are rules that we've created. So let's write them down and create different levers and throttles that we can pull to help make it more automated. Because I think if we can write it out and make it clear, then we also can take some of the burden away and help patients get access easier. Because I think it's truly just writing the rule in there so that when the answer is this, that you can pull that lever and get that person scheduled.
Yeah, exactly. And we haven't really seen there's kind of a baseline of triage, and we don't really talk about triage in physical therapy. That's more of a different term used in other healthcare. But really, what we've started to do over the last year is really try to develop a triage process for our patients. We've got more patients than we can treat, and so we have to determine where we can make those small adjustments. And prior to any sort of logic, it's always been in a front office brain of some sort. So really trying to say, what's our kind of baseline triage rules? What do we know as our North Star for scheduling? We're always going to do these steps. And then there's always going to be an offset where a patient needs to get in and we're going to have to kind of skip over that triage. But really having a way of getting 90% of our patients through this system that's successful not only increases our access, gives our front office more time to do some of the cooler things at the front, like talking with patients about physical therapy and their plan and making sure they're on the wait list versus being on a call for an X amount of time trying to figure out, some of the baseline pieces that could be automated.
And I appreciate that you say triage. And I think, again, any outpatient PT practice, your front office is your hub, and you have the most wonderful individual sitting there for 5 or 6 years, and then something happens. And then you probably go 2 or 3 months with someone clinically, maybe it's an aide or some other person that's helping up front, and you lost all of that scheduling Tetris, if you will. Everybody thinks they know, but you also have the patients that call you, and we're humans. And if you're working in physical therapy, no matter what role you're in, you care about people. And you can't say no. So this is where using scheduling algorithms, if it's a patient that calls and says, yes, I've seen you 5 times over the last 10 years, you're my physical therapist, when marketing is happy. And they say, yeah, that kind of back pain is bothering me again, can I get in? But you're also online too, on the phone with someone that is a post-op. The triage, we all know, and even the person sitting there probably knows should be this post-op patient, but this really nice patient that you also know wants to get in and you give them the spot. So I think using technology to triage clinically first, and I think that was our first goal at TAI. If we write triage rules, let's start with clinical acuity, and then you work through who do you have treating in your clinic. So for our clinic, some clinics have PTs, physical therapy assistants, care extenders as exercise specialists. Different payers will allow you to use different providers. And so we also need to know in the schedule which team is there on Wednesday. And then if you have a smart scheduler or something online, then they know they can schedule different types of payer mixes on that day once we go through the acuity triage. So it's the interplay between all of them all at the same time.
Yeah, I want to reinforce that I think the importance is just that collaboration, writing these rules and creating these systems, is that there is this clinical voice in combination with understanding the payers and the system and the schedule to make it happen. I think our teams have confidence in that system and knowing who's going to come in the door, that they're going to see, that they can provide the care when they know that there's then all of these voices and contributions creating these systems, which I think is really important.
So my question to you, just another area of technology that we cautiously rolled out is giving providers, our new PTs, their data points. And we really started with them with their weekly views of their new patients, their visits. And we've focused more on RVUs, but we show them their units that week in comparison to their RVUs. And it shows them what they did in their visit as far as what codes are they using. So we've had that for 10 years. We rolled it out 2 years ago here at our PT cohort. Do you want to speak to some of the trepidation maybe, and should we release it, should we not, and how's it going today?
I think at the end of the day, people, they want the information. They want and they want to understand what it means. I think as we often use clear as kind information so that people can understand what they're being measured against, I think is important. So I think that transparency with our providers, with our teammates, so that everyone is on the same page and understands is really important. I think how we are communicating, that we're looking at our people, that the metrics that we're using is really important to make sure our metrics are holistic in how we're evaluating and measuring our performance as a company. Just like as providers, we constantly talk about treating the whole patient. I think our providers we need to be measuring and supporting their development holistically too. And I think one, making sure they understand just metrics and how we run a business so that we can keep our doors open and be a successful company. And also right along with it, knowing that this doesn't exist without really great clinical care. And how do we measure the quality of care being delivered? They serve each other. And so that's one of our goals is within our platform and the data that we share so that providers can see alongside, here's how I'm getting my patients through the door. I think what inherently providers want to know, though, is when their numbers are not looking great, is what's happening and what can I do? And I think that's where education, clinical practice, and mentorship, and the holistic development of our team is really important, because it's not just pulling one lever or plugging a hole. That's not actually successful or sustainable for clinical practice. Oftentimes, it's digging in to understand more about what's going on with the prognosis of patient or providers making. What is going on in their thought process? How are they communicating? What are they thinking for this patient? How are they demonstrating value for that patient in the system or in the episode of care? So I think it's really important to have that mentorship and training component of it to actually move the dial, because that is generally what's going to help us be successful in getting our providers in, is getting to the root of what kind of care are we delivering? How are we communicating to our patients? How are we demonstrating value to the patient and making sure they understand? I mean, it comes back to, are we setting the right goals? Are we getting the right expectation? And most importantly, are we having a shared conversation with our patients about what their expectations are, about what we think is possible, about how we're going to get from A to B? When a patient understands what's going on and they feel heard and they feel part of making that plan, there's a lot more adherence to coming in for their visits and commitment to their plan. I think that's one of the most important things to actually have an impact on the data. So,
Yeah, it gives patients the empowerment to feel like they can take control of their care. And we see that from our front office. You'll have patients that come up and they're like, we were told to schedule this and we're going to get it all done and scheduled. And they're the patients that show up to their appointment, that communicate when they are having issues, really just those patients that are set up for those right expectations from the start are really those patients that we see, continuing to show up at our front office as well.
and when we look through the lens, we look at data, when we see a problem, we see a clinic that's really empty. They're seeing evals, but they're not having follow-up scheduled, or productivity is just not looking right. We have to ask the questions of, well, what's going on? Are we scheduling, or are we making the right prognosis for our patients? Do we have an understanding as to what they need to get better? Do we have an understanding of what that patient's needs are, what their abilities are to participate in care? If those conversations are not happening, that can significantly contribute to empty schedules. Sometimes there's other things at play too, but we have to ask all of those questions because they are such a huge contributor to what's going on.
And I appreciate your questions truly come from that provider lens and patient lens, but also, in choosing to use technology, and in this case, partnering with Hychara Health to build a scheduling algorithm using a lot of different people's input. I think when I look at our pilot right now, we piloted in one state that didn't have a lot of online, patients weren't accessing us online. We go to a very different clinic, and within 24 hours, we got flooded. So marketing team along with front office team, we're learning together. But I think in the reflection when we saw, wow, this turned on and 27 new patients last week, and any business owner would be cheering hearing that. And maybe to speak to, okay, but wait, we had a clinical practice front office and operations discussion yesterday about those 27 new patients. Do you want to, just how you can turn something on, you can have a result, but then all the departments have to say, what else needs to happen for that result to truly be successful?
Yeah, I think that really comes down to the process that we're piloting is working.
Right.
So there's something along those lines. To what you're speaking to is like there's something missing down the line. So it's really trying to go to that clinic specifically and maybe ask some of those questions. What are we discussing with patients? Are people bringing the patients up to the front desk to get scheduled? Are there catches for people who are just walking out the door? Like all of those things have to be addressed, but it's usually not the process. It's more of the workflow internally that usually has some hiccup that's causing that. So, and I would say from an online scheduling perspective, I think what we were really trying to determine was what what's the flow going to look like, and then how do we kind of tweak it from there. And with that big spike of increase of patients, it really speaks to, okay, this can work. And I think that has been such a hesitancy in PT because of all the specialties, our different appointment types that we're using, all of the different payers, all of the rules. There's always been a hesitancy of online scheduling just isn't going to work for physical therapy. And now we just proved that it does. So now we have to go back to our clinics and say, okay, we got all these patients in. How do we keep them? How do we get them better? How do we keep them on our schedule? And it really goes to Amy, your question, excuse me, that we've got to do some digging. And we've got to ask all of our different teams, because it's probably not just the front, it's probably not just the back, it's the whole culture of how we're actually treating our patients.
Yeah. And an understanding and expectation of how we keep um, a forward-moving, successful clinic and getting our patients in. So yeah, I look at that and I all of a sudden can't help but just break it down. Does this PT have a good understanding of what's going on? Do they have a good prognosis of how long it's going to take for this person to get better? Then we have the shared conversation with the patient. We share expertise as providers. This is what we think is going on. This is our recommendation for our care, and that takes development. And I say that from our place of mentorship and education. Providers aren't always quick at that right off in the beginning, but it's learning clinical patterns. You learn clinical patterns by seeing people over time. So providers learn those clinical patterns. They lean on their teammates, their colleagues, their mentors, and then we have that shared conversation with our patients about how will this work for you, get their input, and then that next step is then how are we getting them onto the schedule. I mean, that's what we've been working on a lot together. Is some of our clinics walk that patient right up to the front desk and verbally are telling them how to get scheduled. Some patients are taking a scheduling card. Some patients, sometimes it's done through an electronic communication, and sometimes it's just relying on a patient to get up there. All of them are well-intentioned and probably have worked in different capacities at different clinics, but we know there's got to be a more efficient way so that we can make sure people get scheduled based on the conversations happening. And the reality is all of those things have to happen. So three things are true to get that person scheduled in an appropriate way. And patients need to have that and understand it.
I look at it too from just a technology side. So from a front office perspective, really if you've got a problem where you've got an influx of patients and then you're starting to see holes potentially in the schedule and you're trying to figure out what that's coming from or what the driver is, from a front office view, my first dive in would be, okay, are we running an active list? Do we have a wait list? What does our wait list look like? Does it have any sort of priority towards it? How are we labeling it so people can easily access it when we do need to fill a spot on our calendar? What is our referral conversion rate looking like? What's the first touch? But I think one of the things that we haven't really talked about is just what is our completion rate of plans and care and all of those pieces. We can see it from a front office perspective, but there aren't really solid metrics for the front of what the success is for scheduling out that. We always talk about schedule the eval, get a patient in the door, but we haven't really expanded to say, what's a success metric look like beyond the eval?
And that leads me to think about what is a graduation from an episode of care or a discharge, but how do we get there? Because it feels like to me, I haven't been practicing, but sitting in the clinics and talking with a lot of our quality and clinical practice teammates, is that our episodes just keep going. They free flow. So maybe more traditionally 5-10 years ago, you'd write a plan of care, you'd follow your plan of care, you'd make changes if the patient wasn't meeting expectations or moving faster, and then they would graduate and everyone would celebrate and you'd move on. And it feels like as we are looking at our data, they either are really short, like 3 or 4 visits, and there's a research out there showing if you don't go past 4 and you needed it, you're going to lose them. Or they get a little long and, well, just call me in a couple months and see how you feel, versus truly creating what you were talking about a few minutes ago, that the patient understands what the goals are and what success looks like at the end. And that's still really mushy, I think, even to us, to help providers understand how to do that.
I mean, in a time and an era where resources just aren't endless, and I'm not saying that they used to be, but I think we maybe treated them right. It's so important now that we're really clear about setting a goal for what we're doing in care. And a lot of healthcare providers do this. This is really typical in a lot of other settings, but we're setting clear goals. We're making those goals very customized and specific to our patients, and then we create a plan towards them. It's truly creating the framework and the structure for an episode of care. And it really gives a provider structure to build from, helps a patient understand where they're at, and it helps us be able to measure whether it was successful. It's actually quite simple. What I do think happens though is, a lot of people bring in other things, right? And like you said, episodes get really long, but we have to get better at being clear about what it is and how we're navigating it. Otherwise, there's not a good way of showing efficiency of what we do at PT. What I often say to patients, especially in situations where people are really inspired by PT, they find it really valuable, is you can have a primary PT provider. You can have a PT for life, and we promote that because then we know your body and your system, but also we function within episodes. So we set goals, we meet our goals, and we're still here for you as your PT. We can be a resource, we can get you in faster because we know your body, but we function within these episodes so that we can make sure we're being clear and helping you meet your goals efficiently.
What a great discussion. And it has my brain thinking even for what we can do next. But it looks like we're out of time. So let's go around, and if there are any final thoughts. Amy, do you want to start?
No, I think it's exciting to be collaborating around this information from a place of education and clinical practice. I think the thing I'm most excited about is being able to collect some data and be able to lean on data to look at how are we providing care, and how does it compare, like when we look at length of episodes and the outcomes that we're delivering. When we look at continuity of care and how we're treating our patients, can we look at that and compare it to the actual outcomes of our patient care experiences? So I think it's really important, the collection of this data, having these systems that we're diving into and utilizing now, these dashboards, they're going to serve our ability to create better training around quality delivery, and helping us deliver better patient care, but also helping our providers appreciate that holistic component of what we do and how we function.
Yeah, as far as just kind of final thought, we've talked a lot about online scheduling and some of the tools that are coming for physical therapy, and just really excited to start to dive into that kind of process. We've talked about it for a long time. We've discussed a lot of the hurdles with therapeutic associates in the past and really trying to build upon that, but just having the technology in place to be able to support all of those things, really being able to get our patients in the door and putting them first, and really understanding that they're wanting a system to be able to access their providers on a more regular cadence as far as PT for life, and really having that ability to do their own care in that way, but also having that consistency front to back and those processes around online scheduling to support plans and goals in the care. So I'm really excited to continue with the pilot and continue to learn on that aspect, but also how can we bring it into clinical practice and make sure that our therapists feel supported as we're going to get an influx of patients through this tech.
And listening to this, it makes me realize the modeling that our CFO, myself, and our Chief Clinical Transformation Officer have been working on every single week since January we meet, is to take this information and continuously pretty much put all financial data and treatment metric data together to say, what do we see? And it struck me when you were talking about, yeah, I asked you about the clinic that had the great influx on this online scheduling pilot. Their business changed in a 1-week period. So the way they were running their business on August 15th was different on August 27th. And we just turned something on, and they didn't recognize, nor would I expect them to, that their business model shifted. So now that brings back to me to talk to the team that's modeling to say, yes, we can keep trying and using technology, but also how can we think forward to say, we think this is going to change your model. They added another therapist at the same time. We know changing your makeup of providers changes your business model. It changes your workflow. So now I'm like, oh, wow, technology changes it as well. So what are all of these factors to make sure we create playbooks as your business model changes, your clinic model changes, and then look to clinical practice and front office operations to set up systems and support the entire episode of care.